would you call for a ban of private long-term care facilities?
I think we need to end them. I think there's no question about
Interesting.
it.
Canadian NDP leader Jagmeet Singh is calling for the end to privately owned long-term care homes. Now, I'm going to discuss in a minute why this is so important and why this is coming up now. But first, I want to remind you that the NDP have really been the party that have been pushing these ideas forward in terms of how the Trudeau Liberals have reacted to the coronavirus. So the $2,000 a month that Canadians receive through the CERB, that was originally an NDP idea in terms of a universal basic income. The Liberals didn't go with the universal basic income, but the CERB clearly was derived from that $2,000 a month idea. Also, the 75% wage subsidy was an NDP idea that the Liberals also implemented, and also expanding EI benefits. And generally, a lot of the response from Trudeau's Liberals have been influenced by the NDP. And hopefully, this will be another one of those. Now, before I get to Jagmeet Singh's video discussing this, I want to give you some backstory or some context here to what is happening in Canada. So this from the Star. The National Institute on Aging says that as of May 6th, 3,436 residents and 6 staff members of long-term care settings had died of COVID-19, representing 82% of the 4,167 deaths reported as of Wednesday. Dr. Samir Sinha, research director at the Institute, says it is a staggering figure given the roughly 400,000 residents living in care homes represent just 1% of Canada's population. So despite representing just 1% of Canada's population, they are 82% of the total deaths reported from COVID-19. Now, with that context in mind, here is Jagmeet Singh on CTV News discussing exactly why he wants to put an end to privately owned long-term care homes.
Would you call for two things? Would you call for a ban of private long-term care facilities?
I think we need to end them. I think there's no question about it. Given the results that we're seeing, the evidence that we're seeing that some of the worst conditions that seniors are in and some of the highest deaths have happened in the for-profit long-term care homes, there's really clear evidence that it's the wrong way to go. Profit should not be the motive when it comes to how we care for our seniors. They need quality care. They need high quality, safe conditions. And the for-profit system has failed, and long-term care homes in general have failed seniors, and we need to do a lot better.
To be fair, public ones have not done very
That's
well.
right.
So who would pay for that? Do you think the federal government should have strings attached on the Canada Health transfer? We'll give you the money, but it's got to go to long-term care homes. Is that it?
Well, we've suggested, and we campaigned on this in the campaign, that we should look at national standards, so a care guarantee nationally, and then work to roll in long-term care home into the Canada Health Act. So there are those accountability measures, and absolutely the way our Canada Health Act works is transfers are based on a number of principles about quality, about accessibility, about it being publicly delivered. And similarly, we could bring those same criteria to long-term care homes as well.
All right, so Jagmeet Singh's idea here is to end privately owned long-term care homes by folding long-term care into the Canada Health Act and have it regulated nationally. So this right now is not the case when it comes to long-term care. Long-term care, there's some publicly run facilities, some private. So it's this total, patchwork approach when it comes to long-term care compared to other aspects of healthcare that is covered under the Canada Health Act and regulated federally. Now, more context here in terms of reasons why these issues may be arising in long-term care. So Sinha, who again is Dr. Samir Sinha, research director, his explanation for how COVID-19 could be so destructive in long-term care homes while the rest of the country has avoided such a severe hit echoes that of many others who have closely studied the issue. He said Canada's senior care sector has long struggled with underfunding and neglect, leading to consequences that include workers being employed at multiple homes and frequently moving between them, making it easier to spread a virus from one facility to another. Additionally, he said those employed by long-term care homes are often paid significantly less than they would be to perform the same functions at hospitals and may not receive benefits or paid sick days, meaning they may be less likely to stay away from work even when they feel sick. So this is really an issue that exists because long-term care is not a part of the Canada Health Act. I mean, the idea that there are people, that the employees in these facilities are performing the same functions as they would be in hospitals, but making a lot less money and not having paid sick days. I mean, it shows you the real blind spot here when it comes to Canadian healthcare. So this is based on what we've seen, based on the damage that has happened mainly in long-term care because of the coronavirus. This has to be something that will be addressed, and I think it will. The Liberals so far have been responsive to NDP proposals, as I've discussed already. So this one, I think, is an obvious step in terms of improving the way that Canada deals with long-term care.